Cold and flu season right around the corner, and everybody is susceptible to catching one of those, even little babies. Dr. Laura Wilson is here. We're normally listening to you right now, but instead we're going to listen to Dr. Laura this time around.
Good morning. Good morning. Yeah, we wanted to talk a little bit about cold and flu season in babies, since that's, of course, coming up just around the corner. One of the best things as far as prevention is just hand washing, and I think we hit on that a little bit the other day, just good hand washing. And, you know, of course, a baby doesn't necessarily need to wash their hands, but mama should wash her hands after y'all go to Walmart or Target or wherever you go out, you know, and just keeping baby at home as much as you can during cold and flu season is, of course, a great idea.
Yeah, and you can't medicate a baby like you do an adult. They can only take limited things.
Right. I mean, just the basic nutrition and sleep and all that is the best way to keep baby healthy, but no routine medications. And if they do get a cold or cough, really don't want to use anything under about 2. That's the new FDA guidelines.
And it's really difficult to determine how sick your baby is. You know, they cry all the time, so it's hard to know if they're crying because they're not feeling well. So help us about when it's time to go to the doctor. You see a lot of folks, I'm sure, that probably didn't need to make a trip, and some that should have been there last week, right?
Right. Well, there's 5 things that I've put on a list here to kind of go over. One is fever, and everybody asks, how high is too high? What kind of fever is a problem? You know, when do I worry? Well, the answer is not that simple. If you have a baby under 2 or 3 months, any fever deserves a trip to the doctor, and a fever is 100.4 or greater.
100.4.
Right. Okay. So roughly 100. That's easier to remember. Now, if you have an older infant, 3, 6, 9, 12 months, up a little higher, I might tolerate 100 or even a 101 fever in light of some cold symptoms. You know, little runny nose, little cough, little low-grade fever, eating good, acting good, that's fine.
Now, when you say go to the doctor, I want to talk about this for a minute. If a fever's over 100, we go to the doctor. What if the fever's 102 for a 2 or 3 months old? Do we need to go to the emergency room?
Well, if the baby's under 2 months, I would, yes. If the baby's 2, 3, 4 months and we've got 102 fever, but the baby's still eating it probably could wait till the following morning.
Okay. You never know whether to wait or to go to the emergency room.
And if all else fails, call the doctor's office. You know, everybody should have an after-hours line, so if you're really unsure, you can always call and get some help from a nurse or the doctor to help triage your questions.
Right, great advice. Let's get back to the list because there's some other great information on here as well.
Number 2, I think I have on there is respiratory difficulty, and that would be things like retractions or breathing too fast. If you have a baby with a cold that is breathing more than about 50 or 60 times a minute, that worries me. Or if he's got what's called retractions, and that's sucking in below the ribs or between the ribs, or just generally breathing too hard or too fast. You can always count, literally watch 1 minute on the clock and just watch the baby's chest and see if the baby's breathing too fast. That would be a sign to me that it could be something a little more serious like RSV or bronchiolitis.
The other tip is watching diapers, right?
Right, oh yeah, signs of dehydration definitely deserves a trip to the doctor. Less than 1 wet diaper every 6 to 8 hours, dry mouth, not crying tears, just kind of lethargic. Of course, those are all reasons to get baby checked, even if it is just a common cold. If they're getting dehydrated, that's still a cause for concern.
Okay.
Number 4 on there, I believe I had if there are any signs, number 4 I had if there's a general worsening of conditions. So if you've got a basic cold, maybe a low-grade fever, kind of cold and cough stuff, and then things get worse, we get a new fever, baby's not sleeping good, that makes me worry that maybe there is a secondary infection that's developed, like a pneumonia or an ear infection. Those kind of things commonly follow a cold.
Right.
The 5th one I have on there really refers more to the baby's alertness or mental status. If baby is excessively sleepy, if baby's trying to skip multiple feeds in a row, then that concerns me too for possibly a more serious infection, even something like meningitis.
Yeah. So what they're taking in and what they're putting out.
Important, very important. It's always what parents focus on anyway, but it is very important. Yeah.
Exactly. That is great advice across the board. Maybe we'll get that on the Good Morning Arkansas blog as well, so you can go back and do a little follow-up. I want to talk about Dr. Laura Wilson, where you can find her when she's not here with us. She's at the Sherwood Family Medical Center over in Sherwood, and some information to call the office there. And I also want to mention this terrific resource, which we continue to talk about here on the program. That's a Happy Birthday Baby book. The folks at Baptist Health put this out. If you know someone who's expecting a baby, you're expecting a baby, make sure somewhere along the way they get their own copy of the Happy Birthday Baby book. Great savings for things you need and great advice as well. Dr. Laura Wilson, thanks. Appreciate it. Good stuff. Coming back in Good Morning Arkansas right after this, we've got some news coming up. Don't go away.
Well, it is something every new parent worries about. We're talking today about SIDS, or sudden infant death syndrome, and Jessica Donahue is in from Baptist Health, part of our Healthy Baby segment, to teach us a little bit. Good morning.
Good morning. Thanks for having me.
I do know that parents worry about this, even if they feel like they've done everything right, putting the baby down.
Right.
Yeah.
They do. SIDS is something that's on the mind of any new or expectant parent. It's one of those scary stories that you hear about, and you want to do everything you can to prevent it.
There is a lot of research, though, coming out all the time on things we can can do to prevent it. And one of those is just basically how you lay baby down, right?
Exactly. Safe sleep is a very big issue right now that we're teaching in a lot of our classes. And the biggest thing that they want to remember is that babies belong on their back to sleep. And that is relatively new. There'll be a lot of grandmothers and mother-in-laws that will say, well, I always put the baby on their stomach and that we were fine. But the latest research shows that infants are safer on their back to sleep.
Okay.
Some of the other things that are important is not keeping the baby or the room too warm. And so you want to make sure that you don't have them covered with too many blankets and that the room isn't overly warm.
Right. You think, oh, babies will like it when it's warm, but no, it's actually kind of the opposite.
It is. And the other problem with lots of heavy blankets or soft bedding, that's another thing. You want your baby on a firm sleep surface.
Right.
And you also want to make sure that any crib or bassinet that you purchase meets the current safety standards.
Okay.
Your pediatrician is a good resource for getting those standards, and also there's several websites.
This is called a play around?
Well, this would be what we're using for the demonstration today is just a pack and play,
Right.
and it may be okay, but you just have to make sure that you
Make
check the
sure.
safety standards.
This is a little bit more of a portable crib
Yes,
that you might take
exactly.
with you somewhere.
This would be something, you know, that you could put in the parent's room, and as long as it has the firm surface, not too much soft, not a lot of soft bedding, and it
Right.
meets the current safety standards, it would be okay.
And not a lot of pillows and
No.
the stuffed animals. They're cute, but they don't
They're
need to
very
be in there
cute.
when the baby is, right?
They're one of the recent theories about SIDS is that it may have something to do with the infant rebreathing their exhaled air. And so anything that can interfere with good air circulation can be a real problem.
Okay, swaddling is something that they really like.
Yes.
And it's supposed to help as well.
Swaddling is a great thing simply because you want, it helps babies actually lay on their back more comfortably. But again, since we don't want a lot of excess blankets, this is an excellent garment. It's called the Halo Sleep Sack, and it's a combination sleeper and swaddling blanket. And so it covers lots of the safety issues around SIDS.
Okay.
The baby will not be too hot because you don't have to have lots of blankets.
Right.
It unzips. This was definitely invented by a mother. It actually unzips from the bottom to make diaper changing easy. You don't have to take the whole thing. But it's a wearable blanket.
Right.
And so you'll put this on your baby. They'll be plenty warm. The newborn one has a swaddling blanket, but it's attached. So it's not something that's going to get bunched up around the baby's face,
Right.
like one of the things that we're concerned about.
Not
with
like a
SIDS.
loose blanket would.
A
over
loose
there.
blanket could, as the baby moves and wiggles in the nighttime, can actually block where they're breathing.
Okay, you mentioned the rebreathing and keeping fresh air. One of the things that came out just this week was possibly a fan in the baby's room will help.
Yes, that was one of the latest recommendations. And again, we always recommend that moms consult their pediatrician for any news they hear on TV or the latest things. But yes, that does tie right into the circulating of the fresh air. There's mattresses out there now that claim to do that as well,
Yeah.
to not trap that exhaled air.
When I
which
heard it
is
though,
one
I
of
thought,
the
oh no, the
things.
doctors are going to say, you know, don't forget the other things and just think a fan is going
Yes.
to do it. You still have to remember these rules that have been
The
in place.
biggest thing is back to sleep, and then the other risk factors are prematurity, so women need to get really good prenatal and continuous prenatal care to avoid premature birth. Infants who have parents who smoke are at a very high risk. Don't smoke. Don't let anyone smoke around your baby. And then educate anyone who's going to care for your baby
Yeah.
about these safety tips.
Oh, yeah.
Because you may know them, but the person babysitting or taking care of your child may not.
About 23 SIDS deaths a year, you said.
2,300
2,300,
in the
yes,
United
exactly.
States,
I'm
so-
sorry. We want to remind you about the Happy Baby Birthday Book, which we have been partners along with Baptist on for a long, long time. All you have to do is give them a call there at Baptist or log on to KTV.com and we will get you your